Good afternoon. Thank you to the daily briefing here at the EMA office, where we were joined once again with Chairman Mark Kern and Sam Behrman from the Health Department. And Sam, today isn't the day you walked in and said no numbers.
It is not. It is quite the opposite of no numbers today. So as we have done in days past with the briefings, the numbers that we will report for St. Clair County are St. Clair County residents that have been tested. As of today, we are at 2,303 that have been tested, with 550 positives, which is an increase of 32 from yesterday, and that includes both males and females from their teens up to their 90s. We're at 1,724 negative test results, with 28 test results still pending. And we do have some sad news to report today. We have an additional 6 deaths that we are reporting, which brings us up to a total of 47, and that includes 2 males in their 70s, a female in her 80s, a male in his 80s, a female in her 90s, and a male in his 90s, all who did have underlying health conditions. And our condolences go out to the families who have lost loved ones to this virus. For state totals, we are at 319,313 that have been tested, with 61,499 that are positive, which is an increase of 2,994 since yesterday. And we are at 2,618 deaths for the state, which is an increase of 59 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we have 54 patients currently admitted due to COVID-related reasons, and 5 of those patients are currently on ventilators. For long-term care facilities that are in outbreak status, which means 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Berea of Belleville has 12 cases and 2 deaths. Berea of Cahokia has 5 cases and no deaths. Colonnade in O'Fallon has 3 cases and no deaths. Four Fountains in Belleville has 54 cases and 11 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. St. Paul's Home in Belleville has 5 cases and no deaths. And Lebanon Care Center in Lebanon has 30 cases and 4 deaths. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So today is the 51st briefing that we have all done. If we hadn't been doing all these things for 51 days, the COVID-19 cases would be exponentially higher in St. Clair County. The deaths would be the same way. So just remember, as things start to loosen up, we have to be vigilant. Until there is a cure, until there is a vaccination, loosening up is going to increase the cases, and it's not going to be a good thing. The only way to solve this problem is to keep the levels low until a vaccination is created, and then we can all go back to our normal lives. Until then, if your immune system is impaired, if you're elderly, if you have health problems, you've got to stay in for certain. Have other people do your grocery shopping. Have other people do the banking and the other things that you need to have done. You've got to stay home. As things loosen up, we expect these numbers to bounce back simply because people are going to be out. We have remarked that we haven't seen people wearing masks in a lot of places. It's a serious thing. Wear those masks and we can get over this. We need your help. It may seem like you're not doing anything by following these simple steps, but you are. You've held it down for 51 days. And continuing to do this is going to allow us to manage the treatment. Today, the zip code reports, we've seen an increase in most of the zip codes today. In 62201, we now have 13. That is an increase of 1. In 62203, we have 20. That is an increase of 2. In 62204, we have 26. That's an increase of 4. In 62205, we have 20. That's an increase of 3. In 62206, we have 51. That is an increase of 4. In 62207, there now are 26. That number remains the same. In 62208, we have 36. That is an increase of 2. In 62220, we have 53. That is an increase of 2. In 62221, we have 43. That's an increase of 3. In 62223, we have 35. That's an increase of 2. In 62226, we now have 74. That's an increase of 1. In 62232, there remain 6. In 62239, there remain 8. In 62254, there remain 17. And in 62257, there remain 7 COVID positive cases. In 62258, we're still at 14. But in 62269, we now have 48. That's an increase of 4. And 62285 remains static at 6. So we're still seeing a lot of growth in St. Clair County. The deaths are going up. Hospitalizations went up again today. So we're not through this yet. We've got to continue to do what we've been practicing. This is Teacher Appreciation Week, for those who didn't know. And it's always good to think about education. Our kids are at home, they're learning. But with graduation season on our doorstep, we brought in today Susan Sarfati. Susan is the regional superintendent from the Regional Office of Education in St. Clair County. Susan, welcome.
Thank you, Chairman.
And
Happy Sunday.
You've been here. You were here last Sunday. You've been here on numerous occasions. But now graduation is in the air. What the heck are people going to do for graduation for their children?
Well, it's really hard for kids. 8th graders, seniors, people graduating, kids graduating from college, because these are some real milestones that we remember. I'm sure you remember your graduations. I remember mine. I can remember my 8th grade graduation from West Junior High. And so yesterday we got some new guidance from the State Board of Education about what schools can do to help celebrate graduations. So the first choice and the most optimum is to do something virtual, whether it's using social media, doing a virtual ceremony, or videos that are posted. But there is the second option of doing something. There are several ways that schools can hold an in-person kind of graduation. If they can socially distance in an area, they can do that. But the state board is recommending that we do possibly drive-in, where everyone in one family stays in one car, but you have all the cars for the graduating seniors together, someplace in like a large parking lot or a drive-in theater. They also have talked about doing drive-throughs, where the graduates stay in their car, get their diploma and move on, and then just the graduate gets out of the car and has a photo taken by himself or herself, and so that's a way to celebrate. They're also suggesting that you could possibly do an at-home ceremony where a teacher or the principal comes to a student's house. That's probably not going to happen in Belleville 201, where the graduating class is over 500. So that would be something for maybe a smaller school. And then those are, I believe, all the choices that and also possibly an individual ceremony at the school. Again, that's not going to be practical for a large district.
That would have to be a small school, but this is up to the school board or to the superintendent?
The school board and superintendent would be working together to develop a plan.
Do you know of any plans yet, or I guess that's all still in the works?
I do know one district was planning, they'd already been planning a drive-through where a car full of the immediate family would drive, the diploma would be put in the back seat, and then they would drive to another spot and have their picture taken behind a backdrop. But then there was some mixed messages from the State Board of Education last week, so they didn't know if they were going to do that or not, but now we have this final guidance, hopefully final guidance.
So parents should hear now that final guidance has been issued for graduation season.
Right. I think it'll come very soon.
So so graduation marks the end of the school year. A lot of families depend upon the schools to provide lunch, breakfast in some cases. What's being done to try to make sure that that since those meals aren't being provided in a summer program or in another type of educational program, that families have access to nourishment.
Our schools have done an amazing job from our first date of March 17th, when we started making meals and distributing breakfast and lunch to students that were already on free and reduced lunch. And then that kind of morphed into any student who needed food, whether they were on free and reduced lunch or not, could get a free meal, breakfast or lunch. And in some districts they were delivered through the bus routes, and others there were pickup points. But the Illinois Department, and I'm going to read this to make sure I get it right, the Illinois Department of Human Services is now expanding and giving parents that have school-aged children who are on free and reduced lunch additional money, as we know that they've been home all day, and we all find it very easy to go to that refrigerator and see what's in there because we need to snack. And so they're doing additional funding, and it would be $182.40 per child, and that's based on a daily amount going back to March 17th all the way through the end of the school year. So whatever, I know that there are different dates that school districts end, but whatever that end date will be. So the current SNAP recipients don't need to do anything. That money will automatically be put into their link account. But for those who have children that are on free and reduced lunch, but not part of that SNAP program, they have to apply for that. And they apply at, the best way we were told is to apply online at abe.illinois, spelled out ILLINOIS.gov. And so that is, then they would be issued a link account.
And just because people haven't had that in the past, this is all new. Many people have lost their jobs, employment, income. So all these programs, like SNAP, are available to people maybe where it wasn't available before.
Right, and several weeks ago, the State Board of Education asked all of our districts to update their free and reduced lunch numbers, knowing, just as you said, that we have more people that are on unemployment and that need this support at this time.
So last week we talked about trying to set up times for kids to pick up at school, pick up their personal belongings that they might have had in their lockers, school lunches that might have been there since St. Patrick's Day.
That's scary.
Are you aware of any schools that have already started to have kids come in and get their items?
I don't know that they've started to have people come in, but I know that they're making plans. I know that one district has planned to set up stations where they first drop off textbooks that they may have, and then at the next station they drop off any technology that they have that's part of this, that belongs to the school, and then at the last station they get the bags of goodies.
Okay, so you got to drop off before they get.
Right.
So, thank you, Herb.
Well, we appreciate you coming in, Susan. We have our question and answer session today, but I think this just shows how this thing is changing daily.
Yeah.
But we appreciate you bringing that information in for our viewers, because it's a real important information for our students and their families. So thank you again.
You're welcome.
Thank you, Susan,
You're
very
welcome.
much. We appreciate your coming in and being a source
Thank
of
you.
knowledge.
So as we promised, Sundays is our question and answers day, and Brian Whitaker will be joining us, and Sam Bierman will be right back in here with us, because she gets to be the lady of the hour, gets most of the questions. So we'll get started here. Thanks, Sam.
Happy to be here.
Yeah. Oh, me.
Well, since Director Simmons put you on the spot, we'll start with your first question.
Sure.
And it actually is going to be a multiple part question, because there's
Okay.
a lot of questions coming in about this topic. So we'll probably spend a few minutes here.
Okay.
The first question that came in is, why has there been such an increase in long-term care center cases?
Which is a very good question. For those of you that have been watching the daily briefings, you will have noticed that not only have we started announcing long-term care facilities that are in outbreak status, but I'm sure you've noticed the numbers going up as well. As we had talked about probably the past couple weeks, as we increase testing, we expect to get more positive test results. So as we had started testing in the long-term care facilities for both their residents and their staff, the more people we test, the more positive test results we expect to see. So as we started the testing, we expected for the numbers to go up as far as positive test results within those facilities.
Okay, and with that question in mind, there have been some comments today that they're seeing more cases in a single zip code more cases in a nursing home than the entire amount of cases in that zip code. So that kind of goes into your statement you made earlier. But if you would clarify the difference between positives and
Cases.
under investigation there,
Yes.
as it reports in just the long-term care centers.
Sure. So when we give the long-term care facilities that are in outbreak status, that means 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms. So when we give the long-term care facility numbers that are in outbreak status, you will notice we say X amount of cases. And that is a combination of both people that have been tested that have a true positive test result, as well as those staff or residents that have COVID-like symptoms. So when you see a higher number coming from a long-term care facility when we do those updates, higher number than what we are giving in the zip code updates, that is why. Because we count not only positive test results, but people in that facility that also have COVID-like symptoms.
And then the final part of that question, I'd love to start with a 3-part question. Long-term care center staff member that tests as positive is reported in their zip code of residency, correct?
That is correct. So let's say I work at a facility in Belleville, but I live in O'Fallon. My positive test result would be reported in the city in O'Fallon, the zip code that I live in O'Fallon, not for the zip code that the long-term care facility it resides in. So yes, you are correct.
Thank you very much, Sam. While we're talking about zip codes, Chairman, as you do the zip code report every day, something that's come in a few times and we've addressed, but probably needs some reiteration here. The question is, why does the daily positive increase not always match the daily zip code increase?
Well, Sam can certainly tell us that, but what we found is that the state numbers, the zip code numbers are put together by the state. Sam and our health department keeps track of those health department numbers. So our numbers are accurate as to right now at 3:30 every day that we give you those numbers. Some days the state lags behind, some days they may be a little ahead, and so that's where the variance in those numbers comes from.
Well, and I think it's worth pointing out, Chairman, and we've done that quite a few times, is the state is compiling those numbers from 100 plus counties. And those numbers may come in the morning, they may come in late in the afternoon. We keep telling our followers, we get ours every day at the same time, as you said, from the health department, and those are the accurate numbers that we're going by.
And sometimes the state gets them from Missouri, and it just depends on if those Missouri entities remember to contact us or came forth every day. We try contacting everybody, but there's times when things get in the way of that, and they really are required to give us the information, but sometimes that's delayed.
And what we've seen, if you go onto the Illinois Department of Public Health website, and what we've prefaced our numbers with that come from the state, those numbers are provisional, which means that they can change. So they are not set directly in stone when you see them on IDPH's website.
See, I told you, Sam. No.
Well, thank you all. Chairman, the next question for you is, how have St. Clair County employees been affected by COVID-19?
So we've learned a lot in the past 51 days. Our employees have been affected greatly, and depending on their duties, I guess in general, our employees have learned to social distance, to be able to do their tasks at work while remaining safe with their coworkers. Many employees are working from home. That's something that never happened before. We have duties that we have to get done, essential duties. So, for instance, in the sheriff's department, they are wearing protective equipment when they go on calls. But now, an additional safety measure that we've taken is to make sure they're notified if they're going to a COVID positive residence in St. Clair County, in the unincorporated area of St. Clair County. All these things have changed the way we do business. So then the dispatch center they've got to make sure they stay healthy because we rely on them every day. And now they have one more more questions to ask when you call in with a 911 call. And they also have to make sure that when they get a call at a residence and they dispatch it out, that they let whoever the dispatching the party that's dispatched out to the call, they have to make sure they know that is a residence that has a COVID positive there. The courthouse is still operating. We're still providing all those services. But when we start letting the public back into the courthouse, and right now, unless you're going to the court system, the public really isn't in the courthouse. We'll have an all-new set of restrictions and measures that we're going to have. We'll have plastic up in the offices to shield our employees from the public and from spray that can take place. All sorts of different rules and regulations that we'll have until we can get over the virus, because we're not only protecting the employees, but we're protecting the public, and that's a very important thing that we're now doing.
Well, I think it's important, Chairman, to let the viewers know that these aren't just things that are being done at the split of the moment. You're having meetings with the department heads, and this is a plan that's being laid out, phasing this back in to where when we get the okay, and everybody, the medical experts are telling us it's okay to do, that plan will be in place and will be phased in. So I applaud all the department heads for taking the initiative to be on the team.
And we've been planning for reopening now for
Yes.
a month and a half. But just like there's a shortage of PPE, there's a shortage of plastic and plexiglass and all the things that are required to be in place to be able to get the public back into the courthouse.
Thank you. Director Simmons, we're getting a lot of questions in the live feed about this, so we're going to jump down to one that came in earlier about businesses that might not be following all the guidelines as far as the required social distancing or things like that. And the question was, if someone reports a business or person violating the executive order, can they remain anonymous, and how do they do that?
Yeah, there's numerous ways that they can do, especially here in the county. We're not going to make the mistakes that some areas have made. If somebody wants to call that in, as of today, there's a new portal that they'll be able to go to online. They don't have to leave their name or anything like that. Those will get monitored every day. Just like these questions that come in on Sundays, we'll be able to field that, and then those will be sent to the appropriate authorities. Depending on what that is, if somebody's calling to say, we had one last night that there was a large group outside of a liquor establishment, didn't want to leave their name, we got the address, we forwarded that on to the local authorities, and they were able to go and reassure the people that they weren't following the rules. So yeah, you can remain anonymous. We don't leave your name, just give us that location and we'll pass it on.
Okay, thank you. Sam, a question that's come in that we talk about quite frequently. What does it take to contact trace a patient?
So it's a pretty involved process. When we receive the positive result of someone that has been tested positive, we contact that individual if they're able to be contacted. Sometimes that's not possible if they are in the hospital, if they are unable to speak to us, but luckily that is a very small percentage of the time. So we contact that individual. What we do is we find out from them when their symptoms started, what symptoms they had, the date they started, and we backtrack a little and find out where they had been in the previous days, who they had been in contact with. And then we go from there. Hopefully they have the names and places of where they have been, and the people that they have been exposed or that they've exposed themselves to. And we then contact those individuals to find out from them if they're having any symptoms, how they're feeling, and then we take it from there. Sometimes that results in us sending someone to be tested. Sometimes it doesn't, but no matter what, we're following up with all of those individuals, letting them know that they did have exposure to someone who was COVID positive, letting them know what their home quarantine time frame looks like, and then obviously letting the individual that had the initial COVID positive test what their home quarantine time frame looks like.
And Sam, I think it's worth mentioning that it's not really simple.
It's not. There is not a.
Especially if the citizens aren't following the social distancing, the more people that get added into the equation, the more work it takes to do.
The longer the process becomes. So let's simply say that I tested positive and I live in a house with 4 other people. So that's a total of 5. So not only am I positive, but the health department will contact the remaining 4 people in my house and say, what symptoms, if any, are you experiencing? And if you are experiencing symptoms, where were you in the past couple days? And then, so for each of those 4 people, then we have to expand out. And, those 4 people, each one of those 4 might have an additional 3 people that they were in contact with. So it is not as simple as it seems. There is...
Be like a big spider web.
It exactly is. You can liken it to that, and that's pretty accurate, So that's why, we keep with the social distancing, how important it is. How important it is when you're out. If you cannot maintain that 6 foot of social distance, as the governor's new executive order said, to wear a mask, that dramatically drops your chances of, being in contact with someone. If they are COVID positive, drops your chances of, of testing positive as well.
Which also means that will help lighten up the investigation work that has
It
to be
does.
done. So
Absolutely.
wearing the mask is like we talk all the time. It's not that big of a deal. It can save lives.
And really, you shouldn't be out for extended periods anyway. We understand that people have to make trips to the pharmacy. We understand that you have to put gas in the car. We understand you have to go to the grocery store. But you should be really going out to do those tasks and then really returning home immediately after. And if you're wearing a mask while you're out, protects you and those around you.
Thank you.
And if when you're out, you're going to keep a diary and you're going to say, I was within 6 feet, someone wasn't wearing a mask, I was in this place for more than 10 minutes with this person, and that will help jog your memory so that if someone would call because you have been with someone who's COVID positive or you've been tested COVID positive, you'll have a quick access for who the next level of people to call.
And keeping that diary is such a good idea because oftentimes we don't think of it being important to remember what store we were in, how long we were in it, and on what date we were there. So, and as these days continue to go on with the COVID response, some days they seem to blend together. So, having that diary and making that easy to refer back to is just simpler. Keep the facts as clear as they can be.
The more information that you can give, the better.
Exactly, the better. The easier it makes our job when we are doing that contact tracing with individuals.
Well, another example that Randy Randolph, our operations manager who's here with us, told us about. He had to go to the store yesterday evening and went in there and walked in and probably was 10, 15 people in there. He was the only one that had a mask on. That just shows you how this thing could just multiply before you even know it. So
Exactly.
Wearing a mask is the best way to go for right now.
And the simplest step to take with the most possibilities for prevention.
Yes.
Yes.
Okay, thank you.
Sam, another question for you here is, I think it would be helpful to know where all the cases contracted the virus or if it was unknown origin. Can you say if a majority of cases are now from known exposure where they got it?
So in the very beginning, when we had our first couple of positive cases, we were able to narrow that down to international travel. And from there, majority of our cases have been community spread, which means that those people have not had any international travel. They have not had any travel outside of where they live. It's simply from them being exposed to community members around them that were COVID positive, and that's how they contracted COVID-19.
Okay, thank you. Chairman Kern, the next question is for you. Will St. Clair County continue to follow the governor's executive order, or do you feel the restrictions in the county would be lessened sooner?
Well, we have seen the executive order work for us. We've kept these numbers to where we didn't spike as much as we know they would have had we not all been staying home. So for now, we think that abiding by the executive order is the important thing. It's the law anyway, and so we're gonna abide by that. But seeing our numbers every day as the public does, deaths went up significantly. Hospitalizations went up again. So at this time, We're not taking our foot off the gas. We're going to continue to enforce the executive order, and we're all going to get to a point where we're going to be able to get back to normal as soon as possible. None of us enjoy sheltering in place or having to continually talk about this. But the only way that we're going to be able to get back to where we want to be is to get this virus eradicated, get a cure, and to get to that point, we've got to keep these levels low.
I want to make a point on that, Chairman, and I think back, I think it was 8 weeks ago on a Sunday when you and I got called to go to St. Louis for the meeting, and when we walked in with some of the other regional leaders that was there, but then we had doctors there from every hospital, and I mean, they were some of the best well-known doctors in the Midwest, and I think that's when you and I both said, you know, this thing is serious, and you said from that day, this is going to be led by the medical professionals, and I think that's what you've done. And I appreciate what you're saying there. Don't take our foot off the gas, because those medical people have come in here on our briefings and said now is not the time. So I applaud all of us for at least following what those medical physicians are telling us.
And those medical professionals aren't in Chicago. They're not in Kansas City or St. Louis. Those are doctors that are working here in St. Clair County at our hospitals, and they're telling us that we cannot let up right now, that this will definitely come back in larger numbers if we don't continue to do what we're doing right now.
And we're looking for the day that one of those physicians come in here and say, take your foot off the gas. We're going to celebrate.
Right,
Man.
we are.
So, based on all these topics that we've talked about, one thing that we keep hearing from the doctors is expanded testing is what's needed. The question that came in is, when will testing be expanded to the general public?
So there have been significant loosening of the rules around who can be tested. So virtually now it is the general public can be tested. As we talked about with the representative from Walgreens earlier this week in Cahokia, you can go in, drive through, get a test. You don't need a doctor's script. They're going to ask you a few questions. It's free, and you can be tested. At the state testing sites, you know, the rules are pretty loose. Anybody who has at least any inkling that they might have this pretty well is guaranteed a test. So before, we were restricted by the amount of supplies that were available to test, but now those supplies are readily becoming available. So testing is opening up if it already hasn't opened up completely.
Okay. Sam, the next question is for you. Kind of goes what we've talked about a little bit earlier. But are there any cases of COVID-19 in group homes in the area of St. Clair County?
There are. We currently have 7, and we do those number updates every day when we do our numbers with St. Clair County and state totals. We currently have 7 long-term care facilities that are in outbreak status. And I'm not going to go through the numbers again, but I will list the facilities. Brea of Belleville, Brea of Cahokia, Colonnade of O'Fallon, Four Fountains in Belleville, Memorial Care Center in Belleville, St. Paul's Home in Belleville, and Lebanon Care Center in Lebanon are currently the 7 facilities that we have that are in outbreak status.
And Sam, I think it's worth mentioning some of the information that we got last week about the task force that's possibly going to be coming down. Because you have, what, 47 homes?
47 long-term care facilities, congregate living settings within St. Clair County.
Right. So can you kind of explain on what that's going to be? You know, because there's been some people come in and say, well, we haven't heard about this long-term health care facility.
Sure.
So can you kind of touch on that?
Sure. So we have been given an update by IDPH regarding task forces that will be sent out by the state in regards to long-term care facilities. We are not exactly sure when those visits will begin, but we have been told that there will be teams dispatched to the north part of the state, the central part of the state, and southern part of the state. And those will be Illinois Department of Public Health employees that will be going into facilities and testing, if they have not already been tested, testing the remainder of the residents and staff within those facilities so we can get accurate numbers of where we sit with long-term care facilities across the board. Because as we have said in the past, long-term care facilities, most of the people that are in there, they are that vulnerable population. They have underlying health conditions that make them especially susceptible to COVID-19, which is, a largely respiratory virus. So when we can get those teams, the sooner we can get those teams down here, the sooner we can get those tests done and administered and get results, the better we can be for those long-term care facilities within St. Clair County.
Well, and we had one of the questions the other night come in when we touched about this briefly. Why would they be starting at the long-term healthcare facilities that don't have an outbreak?
Correct.
Because one of the questions was, people are there, shouldn't you be going to where we've got the outbreaks?
Exactly.
But we have staff in there.
We do. And, with the outbreak situation, we know where our outbreaks currently are. And the thinking behind starting with the long-term care facilities that don't have outbreaks currently is to test those employees, because as we know, people can be asymptomatic, which is not having any symptoms, and still be COVID positive. So our goal is to, essentially test those facilities that have no known cases to see if that is the truth, because you could be feeling fine and still have COVID-19 or have had COVID-19. Okay. So our goal is to hopefully put out that fire before it even starts.
That's good. Thank you.
Mm-hmm.
A clarification question came in on that about what makes up outbreak status. I believe
Sure.
you discussed it, but if you could say it one more
Absolutely.
time.
So outbreak status simply means 2 or more staff or residents at one facility that are either COVID positive or who have COVID-like symptoms.
Okay. Next question that came in says, once the state is opened and retail stores can fully resume, will the health department create a list of suggested policies for businesses to use to keep employees and customers safe from passing COVID-19?
Yes. So there's a list of guidance for these various types of establishments that is on CDC website, and they continue to be updated as updates come out for COVID-19 as we move along in this process. But we will, as a health department, obviously, follow any CDC guidance that comes out, Illinois Department of Public Health guidance that comes out, as well as anything for future executive orders that the governor puts out in regards to guidance for specific types of facilities.
Okay. A question that just came in now is there any antibody testing occurring in St. Clair County?
So there is, and let me remind people of this point. The antibody testing does not tell you if you currently have COVID-19. What the serum test does is it tells you if you have built up the antibodies, which means that you would have had COVID-19 sometime in the past. So if you do get the serum testing to tell you if you have had COVID-19 in the past, that's all it's doing is telling you in the past. And as a reminder, that serum testing is not FDA approved yet at this point. Once it does become FDA approved, we will give you all that information once it becomes available, but as of now, it is still not FDA approved.
But there are some places following FDA policies to administer.
That is correct. And I do not have a complete list of those. I do know they are pretty few and far between at this point, but there are some facilities in St. Clair County that are offering that testing.
Okay. And one other question on the health side that's come in is if a person dies of a heart attack but was also COVID positive, is their death considered a COVID death, or is COVID considered a comorbidity of that death?
So when we do our updates for our numbers for St. Clair County residents, you'll notice when we announce any new deaths, we give their age range in decades. So if they were in their 50s or 60s or 70s, and we say either if they had unknown health conditions or if they had underlying health conditions. So if they did have underlying health conditions, that could be many things. It could be high blood pressure. It could be diabetes. So if they did have other health conditions and they were COVID positive, COVID-19 is listed as a contributing factor on the death certificate. It doesn't just say COVID-19, that's it, end of story. It's listed as a contributing factor along with the other health conditions that they had. So it lists health conditions they may have had before they became COVID-19 positive, and then it lists that as a comorbidity of why they died.
Thank you for
And the bottom
clarifying.
line, Sam, is because they were tested as COVID positive,
Yes.
that is a trackable number. We want to know
That is correct.
So that would naturally, the coroner's office would be notified of that, and as you said, that would be a contributing factor.
Correct.
If somebody was at home that had been tested and they have a heart attack. The COVID didn't most likely cause the heart attack. Who knows? I mean,
Correct.
we're not the doctor.
Correct.
But we see a lot of questions on there. I wish people would just stop worrying about that. If that patient was tested with COVID, and if he dies at home, that's the way it's going to be listed if there's underlying health conditions.
Correct. Yes. I mean, no matter what, if the person is COVID positive, it will be listed
It's
as
gonna
a
be listed.
contributing factor. Yes.
Thank you. Hope
Yes.
that clarifies that.
Okay. Chairman, another question that's come in is the city of Mascoutah is trying to pass an ordinance to mandate people wear masks at all times. How does this relate to the governor's stay-at-home order, and is it necessary?
So wearing a mask is necessary. It is going to be, it is one more step that we can take to stop the spread of COVID-19. Mascoutah's been on top of this since the beginning. I think Mayor Dougherty might have been our first, one of the first mayors to appear on here, and he certainly is taking this seriously. The bottom line is people are trying to figure out how to get people to wear this mask. It's easy to wear the mask, and it's respectful to wear a mask. The question is, if someone isn't wearing a mask, are you going to haul them off to jail? I don't think that's going to happen. But we have to be able to come up with ways to tell people that it's necessary that they do wear a mask. We all have known somebody in our past who they go to the doctor gives them good advice, and they think it's real cool not to follow that advice, that it's their right, it's my life, and I'm going to do what I want with it. And that's okay. And in the past, we've seen those people get sick, and we've seen those people die. We've also seen some that made it through. But what the difference between that and now is that if you get COVID-19 now, you're going to have an ambulance driver who could pick you up at your house. An emergency EMS worker is going to come there, and then they're putting their life on the line because you were careless. They can take that home to their family. They can, if they have an elderly parent that lives with them, that can spread there. So then the ambulance goes to the hospital, and the nurses and the doctors and the cleaning staff and everyone involved. And if before you got sick, you went to the grocery store and didn't wear a mask, or you went to other places and didn't wear a mask, if you coughed on a park bench and someone sat on that park bench a day later, they could get this virus just by the fact that they put their hand on the armrest of the bench and they touched their face. So this isn't just about you, it's about the public and the general public around you. It's a selfish thing to not wear that mask. Sometimes you can forget it in your car. Sometimes you may leave it around your neck where it isn't effective. So it isn't a problem if somebody wants to remind somebody in the store, hey, you forgot your mask, or put your mask on. Enforcement's going to be the key. But basically, just to tell people it's the right thing to do, join in this thing. It isn't going to be forever, and we can get through this pandemic.
Well, I think the good thing, Chairman, is you mentioned the mayor of Mascoutah, and we've had several other mayors on, but we talk to them every week, and every mayor, and I think that's a good question who sent that in, because it starts at the local level. If we continue to get support from our local city leaders, the police chiefs and them, why would you not want to be on that team to where we can put this thing to rest? So.
And if these numbers don't continue to rise in Illinois, if you're wearing a mask and it's stopping the spread in and of itself, things are going to loosen up. I mean, you've helped to slow the spread of COVID-19 now by staying home. If it's found to be effective that you're out with a mask, then things can loosen up, and we can start to get back to our normal lives. So I would think the mask is a positive thing in many ways, but most of all, it protects those who you are with and those that are around you.
Okay. One last question here, Chairman, that came in for you was, can you discuss how services can be obtained for individuals needing assistance through the St. Clair County Intergovernmental Grants Department?
The simplest way is to go online or give them a call at 618-825-3200 and tell them what your problem is and see if there is a service out there that can help you with your issue. Whether it's paying a power bill or needing assistance with housing, they can answer all those questions, and in many cases they can provide help for you in whatever your circumstance is.
Well, and we've actually had people calling in to the EOC here that has expressed concern, needing help, and we have been able to send them over to Mr. Stubblefield's office, and those residents have called back or sent a message and said, hey, we really appreciate the help. So if you're needing help out there, there's avenues to get to, and we'll get you to the right people.
And we're trying to tailor some of the federal monies that came in to help businesses restart after things start to open up. So stay tuned. And
again, those are things that you are planning. You and Mr. Stubblefield have been having meetings. I mean, you're just not sitting here today saying it. There's a lot of planning been going on. So
there's a lot going on in the county that beyond what we're dealing with here.
yes, very good.
And Director Simmons, one final question is, does St. Clair County EMA remain able to assist agencies that should they need supplies?
Yes, we've been providing assistance. As you all know, that's been following us there at the beginning, we were having issues with PPEs, but thanks to our state representatives, Chairman Kern, making those daily phone calls, our weekly conference calls, those PPE equipment started coming in. We've been providing 79 different agencies, which consist of our EMS, fire, law enforcement, some of the hospitals, some of the, Sam and I stole from her, she stole from us, feeding it back and forth. Wherever the need has been, we have been able to do that. And right now, I mean, last week we gave out some disinfectant that we got that didn't come from the state. We actually went out and got it on our own. So yeah, right now we're in good shape, but the chairman and I talked earlier, as this thing moves on, we want to make sure that those supplies are there. If you people don't stay at home, and if it continues to, these numbers rise, we're going to need more of those supplies. So, but right now we're taking care of everything.
Okay. That concludes the questions that I received.
Well, what a day. A little longer than normal, but we appreciate all the questions, and we hope we answered some of them. And I just want to recap a little bit. Sam, I can't say enough for, I know it's 7 days a week. You're here several times a day, and we're on the phone. And I know it's not an easy job to do, but you heard our numbers today. Statewide, 2,994 cases, positive cases, 59 new deaths statewide. Here in St. Clair County, we had 32 new positives, 6 new deaths for a total of 47. And as you've heard us say today, people get this virus. It's obvious. We're not telling you anything new there. We've told you that some of them get minor symptoms and they do fine. Some of them don't even know they got it. So yeah, that's okay. That some of them get more severe symptoms, and some of them end up going in the hospital. Some of them do fine and they come out of the hospital. You've seen that on the news. People, come out in the wheelchair and the nursing staff is clapping for them. But then there are some who don't. They die. And those are the ones I want to talk about real quickly before we let you go. I want to talk about those people who are dying on a daily basis from this virus. Each of them is not a number. They're a person. And they all have an impact on their inner circle of their families and their friends. Some of them, have 100, 200, 500, whatever that number is, they have family and friends. I can tell you this is becoming it's becoming mentally challenging, not just for our first responders, for all of our healthcare providers. We know it's becoming mentally challenging for you, but it's also for us here. So we're all in this together. And the thing is there is a human aspect to this, and it's called the invisible enemy. But it's not an invisible enemy because we deal with it on a daily basis. And it has the name, and we all know what that is. It's called the coronavirus, COVID-19. This is real. We've been telling you that now for 51 days. You heard the chairman say that. It's taken a toll on all of us. But if we don't take the warnings from our medical experts, this invisible enemy is going to win. So please be a part of that solution. Stay home and stay alive. And we'll see you back here tomorrow with the next daily briefing, and we'll be back with Cindy for the interpretation to our Spanish communities. Thank you, and have a good rest of the day.